Well, I want to welcome everybody today to the IHE Patient Care Coordination 2017 Domain Update. As we were introduced, we have Amit Popat and myself, Laura Langford. And just as a reminder, this webinar is being recorded, so please take a note and hold any of your questions to the end. We're very glad to have you here today. So let's get started. We have 4 learning objectives that we will cover today, and they center around the history of PCC, which is the short name for Patient Care Coordination, the mission and vision of PCC, our past work, and the most annual work that we did in the past cycle. We'll also touch on how you can get involved in work that's happening in the future. The agenda will follow these learning objectives and goes pretty much in the same order I just described. We'll talk about the overview and the history, vision and mission, our goals, the work that we do, and how you can participate. At the end of that, we'll have a Q&A, and so please do put your notes and your questions into the chat box, and we'll get to those towards the end. IHE began in 1998 with the radiology domain. Now we have 12 domains. Patient care coordination is one of these. It started and has been active since 2004. And this webinar is focused specifically on the patient care coordination domain. We will mention some touch points of PCC with the other domains. But for more general information on IHE or the other domains, please see IHE.net. The history of patient care coordination, as I said, was started in 2004. It was initiated by the American College of Physicians and also the Healthcare Information Management System Society, which we all know as HIMSS. The first profile was delivered by PCC in 2005, and it was also the first content profile for IHE. It was called the Cross-Enterprise Sharing of Medical Summaries, and is commonly known as XDS-MS. And since then, PCC has delivered 23 content profiles, 9 integration profiles, and 7 workflow profiles. So the vision of PCC is to continually improve patient outcomes through the use of connecting technology across healthcare disciplines and care paths. This is done by developing and maintaining our interoperability profiles to support the coordination of care across providers, different patient concerns and episodes of care, and different care settings and times. PCC has 3 different strategic goal areas or different foci of their work. These include content, workflow, and nursing. The content is the coordination with other standard development organizations to develop and promote content templates. In our workflow area, we look at coordinating across the different IHE domains and different clinical workflows and care paths. And nursing is a special focus area for us where we work with the nursing community to develop necessary profiles and white papers to support and enhance various nursing-specific workflows. The scope of PCC includes the general clinical care aspects, such as ordering and care coordination, and it has both the clinician perspective and the patient perspective. The scope also includes workflows and integration needs common to multiple specialty areas. PCC is not only U.S.-based, but it does have an international presence. And as you can see on this slide, we have specifically in Europe, France, and Italy, some implementer and developer roles both there. We also have in Canada some developer roles, in China an implementer role, and in Saudi Arabia an implementer role. And if you want to see the specifics about what we're doing with each of those implementing or development roles, there are links on the slide that will be provided, and also a few other bullet points we can talk about for more detail there. PCC has 3 profiling approaches. These are content, integration, and workflow. Content is kind of self-explanatory. Content is dealing with content. The integration is really looking at our interaction between 2 different systems. And the workflow approach has to do with the patient and multiple different work care providers. So we're looking at cross-domain. So now I'd like to talk a little bit about some of the work we've done in the past. We've got 23 different content profiles, and I've color-coded them here so that you can see how we have some different clinical areas that we focused on. The pink ones are all very focused in the perinatal area. The ones highlighted in green are related to work we've done in emergency care, and the ones highlighted in blue are related to nursing and care coordination. And the ones that are left in black are all very general purpose care coordination type things. We also have 13 integration profiles, and I've carried on the color coding on the next couple of slides so that you can see that we've got several of them that are related to care coordination and integration with nursing and the care coordination. And then the other ones in black, again, are very general and very for any type of care. And we also have 7 workflow profiles. 2 of these are related to the nursing and care coordination. One of them is related to perinatal, and the others are very specific. They're not always just general, like I have the tumor board on there, but some of them, and the cardiovascular, but some of them, especially remote patient monitoring, is something that may be more applicable to different care areas as well. Here's a list of a couple of our early content profiles. Some of these you might have heard because some of them have been used quite readily. One is called the medical summary. It's known as XDS-MS. The other one that's a little bit more common is the exchange of personal health records, the XPHR. And one of our early ones that was a foundation for a lot of work that we've done over the years is the emergency department referral, commonly known as the EDR. We've also have some clinical decision support profiles. Some of these are also well known. The query for existing data, which is called QED, the care management, CM, the request for clinical guidance, RCG, and the retrieve clinical knowledge, RCK. We also have some existing cross-domain profiles. These are profiles, like I mentioned before, where we've worked with other IHE domains to create some profiles that touch in both areas of patient care coordination, but also the domain listed. So, for example, the remote patient monitoring we did in conjunction with the patient care devices. We've also worked with the patient care devices on clinical mapping. And then we've worked with cardiology to develop the cardiovascular heart team workflow definition. Several of the different domains were involved in writing our perinatal workflow. You can see them in there: radiology, laboratory, patient care devices, as well as the quality research and public health. And of course, we've also worked on the guideline appropriate ordering with the radiology team. The description of these can also be found on the slide, but then also on our website at IHE.net.